and a very warm welcome to everyone joining us today for this important webinar on strengthening health systems to protect breastfeeding. This week, as we celebrate World Breastfeeding Week, we come together to understand how hospitals can become enabling spaces for mothers and newborns and contribute to India's nutrition and standard development goals. I am Dr. Vanna Chawla, Vice President Academics and Research at Ujala Cygnus Healthcare, and I have the honor of moderating today's session. To commence this journey, I am honored to welcome our distinguished speakers, Dr. Shuchin Bajaj, Dr. Arun Gupta, Dr. Jaideep Malhotra, Dr. Narendra Malhotra, Dr. Nupur Bidla, Dr. Usha Prabhakar, along with all the audience. This webinar marks our collective commitment to advancing maternal and child health, especially by integrating breastfeeding as a cornerstone of healthcare delivery. To begin, I invite our founder and director, Dr. Shuchin Bajaj, to open today's dialogue and share his reflection on the significance of strengthening health system through the lens of breastfeeding. Dr. Bajaj is a visionary leader, public health advocate, and recipient of numerous healthcare excellence awards. Dr. Bajaj has been at the forefront of inclusive healthcare delivery in Nordic. Dr. Bajaj, please take the floor.
Thank you very much. Namaste and good afternoon to all of you. It is truly a privilege to be here for this important observance of the World Breastfeeding Week 2025. And I want to begin by thanking Dr. Manna and all the organizers and the esteemed speakers on the panel. We are really lucky to have such esteemed speakers contributing their time to come and speak with us and bring us all together on a theme that actually goes far beyond maternal care. It speaks to the very foundation of a healthy society. And this year's theme, strengthening health systems to protect, promote and support breastfeeding, could not be more timely. As all of us who work at the intersection of community care, clinical delivery and system innovation, I think for all of us, I can confidently say that breastfeeding is not just a maternal choice, it is a public health imperative. And why does it matter? Because breastfeeding actually saves lives, right? It is one of the most powerful interventions we have to reduce infant mortality, to enhance immunity, to improve maternal health, and to advance cognitive development in children. And yet, despite all the evidence, all the intent, and all the global commitments that we still have millions of mothers still struggling to access the right support at the right. And brings us to this question, which I'm sure all the esteemed panelists today will address, is why are we falling short? So I think in my opinion, problem is not lack of awareness, but lack of systems that truly enable and not just encourage the mothers. Systems that are designed not only to advance breastfeeding knowledge, systems that are not only designed to advise mothers, but systems that are designed to stand by them in labor rooms, in postnatal wards, in rural outreach clinics, in Sehat Chopals, and in our urban centers as well. Too often, I think we just treat breastfeeding as a matter of maternal willpower, that hoga to karenge, unka money nahi hai ji karne ka, ye hai wo hai na. When in fact, I think it is an outcome of systemic support or the absence of support, whatever we do. So I think we all must reimagine breastfeeding as not as a standalone intervention, but as a cross-cutting indicator of quality care. And we must ensure that all delivery points are breastfeeding friendly, with early intervention, zero formula pushing. I mean, whatever it takes, we must ensure that, and train staff. We must need policies that operationalize the WHO 10 steps to successful breastfeeding, not just as posters on the walls that we usually put, but as part of our standard operating procedures. And we must empower our frontline nurses, the frontline ASHA workers, the frontline counselors with training, time and tools to offer evidence-based and compassionate lactation support. So at Ujala Cygnus, we serve very small town, semi-urban, rural communities, and we've learned that the biggest game changer in our kind of setting is never the best equipment or the budgets, but always empathy, protocols, and accountability. So we should build breastfeeding into our quality scorecards. We must introduce staff incentives for skin-to-skin contact within the first hour of birth. And we must incentivize the staff to build integrated lactational counseling into discharge planning. These are very small innovations, But I am sure with this amazing team, if they are put in place, they will lead to big sustained outcomes. And India's commitment to SDGs, especially SDG 2 on malnutrition and SDG 3 on health, I think rests largely in part on how we support breastfeeding. The Poshan Abhiyan and the Anemia Mukt Bharat also cannot succeed unless and until we recognize breastfeeding as the first step in lifelong nutrition. So, aligning hospital practices with national nutritional targets, I think it's not just good policy, but it is also moral and medical responsibility for all and every institution. So I think we must stop seeing breastfeeding as the mother's burden completely and start recognizing it as our own health system's test. If we cannot support a mother through the most natural and evidence-backed act of care, how can we claim to be building a patient-centered and inclusive healthcare system? So I think we should all listen into this session today deeply because we have such esteemed and learned speakers and panelists, and we should learn how to act so that every mother, regardless of where she lives or delivers, receives not just simple plain advice, but real, respectful and sustained support in breastfeeding. I really look forward to learning from this webinar and really look forward to engaging with the esteemed panelists and speakers on how we can align both national policy as well as organizational structures and systems to make sure that we make this possible. Thank you very much once again, Dr. Mandna, and really looking forward to participating in this wonderful webinar that you put together.
Thank you so much, Dr. Bajaj, for joining us and sharing your thoughts in between your meeting from Srinagar. Thank you so much, sir, for your inspiring opening words. It's now my pleasure to welcome our keynote speaker, a leading national and global voice in breastfeeding policy and accountability, Dr. Arun Gupta. Dr. Gupta is the chief coordinator and founding force behind the Breastfeeding Promotion Network of India. He has been at the forefront of evidence-based advocacy through World Breastfeeding Trends Initiative and networks such as American Accreditation Commission International and Nutrition Advocacy in Public Interest. He has advised WHO, UNICEF, and governments on infant and young child feeding policies. Today, he will share his insights on policy, advocacy, and the role of accountability in promoting breastfeeding across health systems. Gupta, we look forward to hearing from you, sir. Over to you.
Thank you so much, Dr. Vandana and the team of Ujala for taking interest. And can you see my slides?
Yes, sir, we can see.
All right. I'll spend a few minutes taking on from a wonderful speech from Dr. Bajaj in terms of addressing the issue right up front, in that it's not just giving a mother advice to go and breastfeed, because this has been my experience in over 35-40 years now. When we started this has been a block at several levels, including bureaucracy, including medical, whichever specialty we move in, that mothers do it anyway. Who are you to be there, And the first interaction with the Ministry of Health in early 1980s and early 90s, when we requested them to include breastfeeding as an indicator in the progress, we were actually told to get out of the room. So to cut the story short on this particular issue during the World Breastfeeding Week, and when I've been asked to talk on these three areas, what BPNI has been doing for 20 years now, that we do evidence-based policy analysis every 3 to 5 years at the national level, that where the support system is lacking, the hospitals is just one of them. So the women need support not only within the hospital when they give birth, but they too need support outside. So I'll talk briefly on that. Recently we launched the report. We were kind to have at the ceremony of launch of the World Breastfeeding Trends report release. I'll share briefly the findings, not get into the details, but in the end, how we focus on the hospitals to strengthening breastfeeding, to turning them into, so we call it, let's turn our hospitals to breastfeeding friendly institutions, right from, so if we can begin other areas, like fine, but at least the hospitals have a duty to begin from pregnancy onwards, to at least till the child is discharged. So just a brief about the what we talk about the evidence-based policies. BPNI in 2003 and 4 designed a tool for assessment of policies and program based on WHO tools. It has 10 indicators of policies and 5 practices. This is on this website you can find that this program is now rooted in 100 countries and 176 reports have poured in, and we are managing those on this web portal with ranking, color coding and scoring of these. The process used in it is that we use secondary information, but nothing is scored without information. So we constitute a core group in the country where this assessment is taking place. So we identify a national leader first, and then they constitute a core group who meets and discusses about these policies and build a consensus there on the findings and recommendations. Once that is done, we identify gaps and then suggest recommendations. So those are verified at our WBTI secretariat, and then they are given scores and color coding, and then the reports are launched. And when after 3 to 5 years, we again assess using the same tools all over the world. Same tool is being used and see the progress in those indicators. That is how this becomes the report becomes an evidence itself. So these are the areas which I mentioned earlier, that it's not just the hospital. So it's about national policy. What is the policy supporting women and how it is governed and what kind of funding is there. So second is the topic which we were talking today. So we call it, BPNI calls it breastfeeding friendly hospital initiative, but globally still called as baby friendly. And this is based on 10 steps to successful breastfeeding of WHO. So then the third one is the marketing code, like how breast milk substitutes are marketed. Fourth is maternity protection, what kind of maternity leave women get, what kind of protection they get if they don't get maternity leave. Then the whole healthcare system, is it supportive to breastfeeding or not? Then what are the reach of counseling services at every level, pregnancy and post, during hospital stay as well as postnatal period. Then what kind of information women get? Is it accurate, unbiased, or it is supported, or it is industry oriented? Then what happens during infant feeding HIV? What happens during infant feeding during emergency and disasters like earthquakes or floods? And then how the programs are monitored. So the 5 other indicators are which are objective and outcome indicators are timely initiation, exclusive breastfeeding, median duration, bottle feeding, and complementary feeding. This we use from the National Family Health Survey. So first 10 indicators are assessed by the core group based on the nationally available information, and then the report is prepared. Just to give you a brief idea that this is 2018, on these 10 indicators, we had 3 indicators in red in the national policy, hospitals, as well as infant feeding during emergencies. And 2 of them have converted into yellow, that there is improved funding from the government, and the infant feeding in emergencies also policies have changed from formula, now it is breastfeeding counseling. So it's only one. If you see, the only indicator which is in red is hospital support. So that's something which we need to. So there are good indicators. We have good control on marketing. We have good control, good services. There are a lot of people available for services, but somehow or the other, when it comes to hospital, it fails us. So now why I'm saying it fails us? See this slide. 8.6 NFHS 5 data, 88.6% women deliver in the hospitals. Only 41.8% are able to breastfeed within an hour of birth. So that's a huge gap. Only 1 in 2 women gets the hospital support, it means. So now in terms of, like, see, specifically talking about private sector, I think it's a bit of a missed opportunity, because around 8 million births do take place in private sector. In this is 21. Probably there may be 10 million now. And then if you see the cesarean section also rising very fast. So in the private sector is 47.5%. But why I'm saying is cesarean section mothers are not necessarily to fail. It is assumed that they're cesarean, the mothers cannot breastfeed. That's wrong. If we that's where the concept of breastfeeding friendly systems support comes into place. So we developed what's called breastfeeding friendly hospital accreditation program, and we partnered with association providers. This has two steps. One is a self-assessment. The hospitals make a self-assessment and understand the gaps. They prepare themselves for the external assessment. Then we have the 11 interviews carried out by an independent assessor based on the observation and verification of records. And BPNI provides technical support to these hospitals for 1 year and makes them to the tune that they reach the grade 1, which is the accreditation process. So total time might take 6 months to 12 months, but it takes about this technical support, and some hospitals, if they start working earlier, they take lesser time. So in the 70 hospitals which we have, out of 150 requests to us so far have been accredited. And if you see the results, the early breastfeeding rate in normal deliveries is vaginal deliveries is 98%, and in cesarean section it is 97%. So we request these hospitals to continue giving us data every 6 months. So and then we also offer free to use resource kit. It's available on our website, which includes support from pregnancy onwards, and Nupur will share in detail how to operationalize this. And further, if you have any questions, I will be happy to respond to. Thank you very much for your attention.
Thank you so much. Thank you so much, sir, for those powerful policy perspectives. And I'll take the question at the end of the session. So now we have Dr. Nupur Bidla, Central Coordinator at BPNI. Dr. Nupur is a health system expert with years of experience in training healthcare providers and implementing breastfeeding promotion programs at scale. She is closely involved in operationalizing the International Code of Marketing of Breast Milk Substitutes in India. Her work has been instrumental in bridging the gap between national breastfeeding policy and local implementation, especially through staff training, Infant Milk Substitute Act monitoring, and system alignment. Thank you so much, Dr. Nupur, for joining us. Today, she will highlight how we can operationalize breastfeeding policies effectively within hospital and health systems. Please share your thoughts, Dr. Nupur.
Thank you, Dr. Vandana. Thank you for having me and giving me this opportunity. And it's my pleasure to share the stage virtually with all the renowned people. I would like to share my screen to do my presentation. Yeah, so today I'm going to speak about how we can operationalize breastfeeding policy in any maternity hospitals. And my name is Dr. Nupur Bidla, and I am the Central Coordinator with the Breastfeeding Promotion Network of India. We are into policy advocacy for breastfeeding and infant and young child feeding for more than 30 years now. And we also monitor the IMS Act. So we're also a watchdog organization for that. So the overview of my presentation, I'm going to talk about why strengthening breastfeeding is essential, what are the gaps in health systems, and how we can institutionalize breastfeeding support using some of the tools that we have and services that we provide. So I will share the 7 tools in detail, which Dr. Arun shared with you during his presentation, our accreditation program, and the training programs for health staff that we offer. Okay, so why strengthening breastfeeding is so essential and important? As we all know, that breastfeeding saves lives. The early initiation exclusive breastfeeding can prevent over 800,000 child deaths annually, according to WHO. It protects mother and babies from the risk of diarrhea, pneumonia, breast and ovarian cancers, and type 2 diabetes. So as we all know that breastfeeding improves brain development and economic development as well. It is linked to higher IQ and yields some $35 in return for every $1 that we invest in breastfeeding, according to Lancet Breastfeeding Series of 2016 and UNICEF 2018. The current support is inadequate. Globally, only 48% of infants are under 6 months of age are exclusively breastfed. according to the WHO Global Breastfeeding Scorecard. So as I shared why it is important to strengthen breastfeeding support, because it saves lives, it protects mother and babies, it improves brain development, economic outcomes in the longer run, and breastfeeding support currently is inadequate. Therefore, only 48% of infants under 6 months of age are exclusively breastfed across the world. Okay, so the current gaps in health system, as Dr. Arun also shared graphically with you, that there's a huge gap between initiation of breastfeeding in the first hour, that is 41.8%, and institutional delivery, which is 88.6% according to NFHS data. That means that if more than almost 90% of women are giving birth in hospitals, then why only 41.8% of women are able to breastfeed in the first hour? What is happening to the rest of the 50%? So that's a major concern. Then there's lack of skilled staff to counsel mother during the antenatal period. We usually don't see that women are being prepared during antenatal period for breastfeeding. And then practical support at the labor table, and then postnatal counseling and practical help that she needs to establish breastfeeding. Then there's weak implementation of MA program, the Mother's Absolute Affection, the only country level, national level breastfeeding promotion program by Ministry of Health and Family Welfare. It was launched in 2016, and it is mostly based on all the 10 steps by WHO. It is not being implemented in both government and private hospitals. Then there is limited monitoring of breastfeeding support services and practices at the hospitals. Then how can we institutionalize breastfeeding support? So BPNI offers 7 tools which are freely available, accessible to all, through which we can actually institutionalize breastfeeding at hospitals. And these are 7 free tools. It is to guide the hospitals. It addresses specific aspects like breastfeeding support and policy development and other things. And it will actually help and ensure that every mother and baby diet is supported for breastfeeding in a hospital. The first one is a model breastfeeding policy for hospitals. It actually caters to step 1, 5, 6, 7, 8, 9 of the WHO 10 steps that Dr. Arun shared with you all. We have a template of the model breastfeeding policy, and every hospital can download this, can adapt this, customize this for themselves and use it. The second tool that we provide is for antenatal preparation program. It addresses the step 3 and 10 steps, and this tool has educational material for pregnant women. And we have 6 modules. You can see 4 screenshots here. All of these are freely available. They're 1 to 2 minutes module covering all the aspects of breastfeeding preparation during pregnancy, benefits of breastfeeding, early breastfeeding, skin to skin care, positioning and attachment, and other things. These are 6 of them, and they're freely available on YouTube. These could be downloaded. The third one is monitoring breastfeeding data in the maternity hospitals. This helps in data management at the hospitals and implement the step 1C of WHO 10 steps. It is an Excel-based tool that we have created, and you can start, hospitals who are interested can start using it and start recording their breastfeeding data, like initiation in the first hour, skin to skin, then exclusive breastfeeding during the hospital stay, and if there was cesarean section and vaginal section delivery, how did we support women in breastfeeding within an hour or not. So all of this could be recorded, and this is freely available and downloadable. Hospitals can start using it to monitor their and manage their data. The fourth one is the 18 indicators to monitor the programs, and this helps in assessment of hospitals' performance periodically. And we have these 18 indicators. I've mentioned them in the next slide. These could be downloaded for reference by any hospital. It includes 18 indicators which have to be, fulfilled to be breastfeeding friendly or providing support to the mother. The fifth one is on awareness of IMS Act. I hope many of you are aware of this act, popularly known as the IMS Act or the Baby Food Law. India. It is one of the strongest laws in the world. It anchors the International Code of Marketing of Breast Milk Substitutes. It basically keeps a check on the baby food manufacturers so that they don't promote their baby food and baby food products and infant formulas. And this PPT is available there with all the provisions of the IMS Act, what is banned under the IMS Act. It's a criminal law, and every health practitioner should be aware of it and should abide by it in the interest of children, babies, and breastfeeding. So this PPT is available here, and hospitals can download this and can do a one-day session in their hospitals and make their staff aware of it. The sixth one is a template of follow-up support after discharge for mothers. So one very crucial step among the WHO 10 step is that whether the mother is counseled during the discharge time on breastfeeding, on exclusive breastfeeding, and if she faces any issue, where can she come back or where can she go in the community. So this is a very important part, and we have created this template which you can use to coordinate the discharge for timely infant parent access and ongoing support. Some hospitals do make their WhatsApp also with mothers and keep a follow-up with them. The seventh one is a template of constitution of a hospital breastfeeding committee, and that's very important to periodically monitor it, track our breastfeeding data in the hospital. It's very important to have a breastfeeding committee, and we have developed a constitution for it. Hospitals can customize it and adapt this one and can use it and periodically have their breastfeeding committee meetings. Okay, so how do we ensure capacity building at hospitals there so that there is skilled support for women? And so therefore regular training of health workers that ensure competence on IVF counseling and monitoring is very essential. The Breastfeeding Friendly Hospital Initiative emphasizes on capacity building aligned with the 10 steps. And then the ongoing monitoring of breastfeeding practices at the hospital and a feedback mechanism for mothers as well to improve your service is equally important. BPNI offers 4 training courses to ensure that skills are transferred to hospital staff and they can support mothers and babies more efficiently, more effectively. So we have a course, a trainers course, the national training course, which is for 13 days to make national trainers. Then we have a certificate course on breastfeeding and IVF counseling and support skills, which is 4-in-1, a 7-day course. Then we have a counseling-based skill training of maternity staff on WHO 10 steps to successful breastfeeding, which is a 4-day course. So if a hospital intends to become breastfeeding friendly, they can opt for this course for their staff. And then we have a middle level trainers training course for 7 days. Each of the course have a separate cost implication, and if any of the hospital who's attending it who's interested to do this, I mean, they can get in touch with us, with our training team, to discuss this further. BPNI has trained, I think, thousands of health professionals with its training courses since 30 years. Then after the 7 tools that I shared with you, which are free for everyone to use, and once someone starts using it and you feel that you want to apply for a breastfeeding friendly accreditation from BPNI, we do provide those services as well. We have partnered with AHPI, Association of Healthcare Providers India, which is one of India's biggest private hospital association. And we have partnered with them for this initiative called Breastfeeding Friendly Hospital Initiative. And the idea is, the objective is to raise the standard of care for breastfeeding and improve early breastfeeding rates in both normal and cesarean section delivery, to facilitate assessment and monitoring of maternity services using standards that have been tested and validated. So the tools that we use for this accreditation are validated under the technical advisory group of Government of India 4 years back. And this accreditation process gives a certificate of accreditation to hospitals that adhere to a certain standards, and it is done through an independent external assessment. Dr. Arun shared with you the 2 steps. That is how it is done, and this accreditation is maintained for 3 years, and a renewal, a reassessment is required every 3 years. And there's not a pass-fail situation. We provide hospitals technical help to do this accreditation, and they can take as much time as they want to build their capacity on it and be prepared and then apply for it. Okay, these steps have already been shared by Dr. Arun. So there's a self-assessment step for this accreditation. We have a portal, a web portal where a hospital can register themselves and fill a 14-question questionnaire. If they score more than 50%, they're eligible to apply for external assessment. And once they apply for external assessment, assessor present in their local location is guided to coordinate with them locally, and they go and carry out the external assessment independently, which includes 11 interviews of doctors, nurses, mothers, and hospital administrators, and observations and verification of the records that the hospital has provided in the self-assessment. There's a one-time fees for this accreditation for 3 years, that is 20,000 rupees. And for more information, you can get in touch with us. So as of now, BFHI or BPNI with AHPI have accredited 65 hospitals across the country, and they have received the breastfeeding friendly certification accreditation. It includes 20 private hospitals and 45 government hospitals. And out of those 45 government hospitals, 36 are armed forces hospitals and 2 state governments as well. So I come to an end to my presentation. In the participants, we have hospitals attending this, and if they're keen on using our tools, the free ones, and are interested in accreditation and want to know more about it, you can log on to our website, bfhi-india.in, and you can get in touch with us. Thank you so much.
Thank you, Dr. Nupur, for grounding us in the operational realities and pathways forward. We now shift focus to the private healthcare ecosystem. Please join me in welcoming Dr. Narendra Malhotra, Managing Director of Ujala Cygnus Rainbow Hospital and past President FOXI, a senior obstetrician, academician, and author. Dr. Malhotra has been a torchbearer for quality maternal care and reproductive health. His insights will help us understand how private hospitals can better integrate into patient-centered maternity care and play a catalytic role in promoting breastfeeding by implementing support systems throughout maternity and postnatal care. Dr. Malhotra, the floor is yours. I hope you are able to share your screen, sir.
A very good afternoon to everyone who's joined here. As past president of FOXI in 2008, when we partnered with BPNI for starting or for getting our FOXI hospitals breastfeeding friendly hospitals or baby friendly hospitals, as what I call. Today, we see this folder with our Prime Minister and our Health Minister circulating this message that it is very, very important for the private sector to take leadership in breastfeeding promotion. I bring you greetings from our Agra Ujala Cygnus Rainbow Hospital and Global Rainbow Healthcare and our Malhotra Nursing and Maternity Home and Rainbow IVF. So what is the role of private hospitals in the breastfeeding ecosystem? Firstly, we have to understand that private hospitals constitute a significant portion of maternity care providers in India. It was very high a few years back. It is still quite high, but the government sector, of course, is improving the public facilities. So the private sector has come to about equal. And then, of course, there is an inflow of big corporate hospitals. So the smaller nursing homes are finding it difficult to survive. Then there is an opportunity to model for all these small hospitals and private sector. They have an opportunity to implement the WHO recommended baby-friendly practices, which we've been hearing about from the previous 2 speakers. What we all can do as a private sector is influence the policy. We can create a ripple effect in the nearby public and small healthcare facilities so that this ripple travels and becomes like a wave. So a wave of breastfeeding we can start from small hospitals. Then, of course, we have a potential to invest in lactation consultants and breastfeeding friendly infrastructures. That is very, very important, and which you see that a lot of private hospitals, bigger ones, have already a lactation room and a lactation consultant. And we have, especially in our place here at Agra, we have a lactation nurse who makes sure that the golden hour is started. Now, what are these baby-friendly hospitals? The baby-friendly hospital initiative was a great one. There are 10 steps and implementation to get certified, which we just heard. And of course, our application probably of this center is due. My old nursing homes are already certified as baby-friendly hospitals, and I did modify them also. So the baby-friendly hospital initiative, checklist, booklets, folders, and the help which you can take from BPNI. Now these are the two facilities where we work. This was Malhotra Nursing and Maternity Home way back in the 90s, the older look, and which we gave a modern look in 2000s. But right since then, we have been calling ourselves, you cannot read the sign, we have been calling ourselves baby-friendly, mother-friendly and father-friendly hospital. That is a term we added. So we added that the fathers also equally need to be educated on all the procedures. Of course, in the background, you see our modern new facilities, the Ujala Cygnus Rainbow Hospital, which is already in the forefront leading on all these initiatives. So how do we integrate breastfeeding support into our fertility and maternity care? The first thing which we have to do is start educating. And we start educating from preconception and antenatal visits in our centers whenever the patient comes. Lactation counseling is a routine part of fertility treatment and pregnancy care, because you want them to be lactation friendly and lactation literate. Then we need to train all our staff in all the breastfeeding support across all departments. So even if the nurse is changed, she should know. And of course, we promote very early skin to skin contact and immediate breasting. Our babies, whether it's cesarean or whether it is vaginal birth, are immediately put on the breast, and the skin, even if they're not able to suck, the mother can see them, because the cesareans are mostly done in epidural or spinal, and they can touch them, and the babies have a feel of the breast. There was a lovely video somewhere which I could not locate, which I had with you, what we called it as a breast crawl, and the baby was kept on the abdomen and it crawled to the breast, and a fantastic video which shows that the baby does get attracted to the breast immediately after birth. What we are using is the Pradhan Mantri App Challenge awarded app made by Dr. Jaideep Malhotra called as the iMums. And the iMums has preconception, during conception, during pregnancy, and parenting part on it. So the first 1,000 days, the 270 days of pregnancy, and the first 2 years of childhood is all that this app can guide. And it won the Pradhan Mantri App Innovation Challenge. It was on Shark Tank. It was featured on NDTV, and it is recognized by the Ministry of Education, and a fantastic pregnancy guide, preconception guide, and the post-pregnancy guide, which takes you through preconception, the pregnancy care, and super parenting program. That's how we work with this app. And the founders, of course, are Dr. Jaideep and Ravi Teja, and the head office is in Bangalore. But over 10 million women are logged on to this app. It's free, but it also has a paid version where you get a one-to-one coach for it. What we aim by using digital media and apps are that we want to teach the breastfeeding practices, train and teach and encourage. So celebrate World Breastfeeding Day. Why it should be only 1 week? It should be whole year. That is what I feel. And teach this app, and everyone should be taught on what are the various positions. You can breastfeed while sitting, in the football position, in the side laying position, all those positions. And this presentation, if you can see here, by Foxy last year, we presented this to all the general public, and it was widely given, the lectures, webinars all over India on the different breastfeeding positions, how to express breast milk. These have to be taught, and the private sector is taking a lead, and our Federation of OBGYN Societies of India is taking a lead. And if they cannot feed, how to express the breast feed and store it for 4 to 6 hours in a refrigerator, and up to 48 hours, up to 5 days if it is stored correctly. So milk banks can be made. And if the breast milk is not adequate, not coming, then how to improve the measures by correct latching, by frequent feeding, by using post breath, by allowing the infant to empty all the breast and all these things, and by giving them a good nutritional diet which is good of fluids, balanced diet, rest, and galactagogues. So breastfeeding could be special in premature deliveries, and that again our NICU staff and the NICU nurses takes care of that, and our lactation consultant takes care of that. What we advocate in our private sector and what we teach is the kangaroo mother care, that's the first skin-to-skin contact, the breast milk and feeding, and an emotional connect with the baby, which it gives. The kangaroo mother gives the emotional connect immediately after delivery. So, private sector has to promote breastfeeding through its maternity service, and which is doing quite a lot. So we need to ensure that there is a seamless transition from what she was in antenatal to a lactation when she's admitted and to a postpartum. And we implement these as breastfeeding friendly hospitals, or what we call as mother, baby and father friendly hospitals, include lactational support as a part of our discharge planning and give pictures, conduct regular audits and feedbacks session for quality improvement. So in India, we still need to work, and you heard that breastfeeding is so low. In India, the institutional deliveries has gone up to 80-90%, but early breastfeeding in the first hour is still very low. So we need to prioritize breastfeeding, create a sustainable support system. The system has to be created, which Dr. Shuchin Bajaj was emphasizing in his introductory remarks. So how do we do that? Strengthen the postnatal, schedule postnatal follow-up, lactation support, create breastfeeding helplines, create tele-consultations, tele-lactation consultations, engage all the family members to support continued breastfeeding, link the mothers with local breastfeeding support groups and NGOs. That is what we also try to do. So that is what my thoughts are about private sector involvement. Thank you very much for this opportunity. We need to say that breastfeeding is nature's best gift. It is baby's right, and it is mother's power. Thank you for being here on this webinar and for letting me share some of my thoughts on the involvement of private sector. Thank you.
Thank you so much, Dr. Malhotra, for taking us through the wonderful work you have done so far and for the actionable insights from the private sector. Now it's my honor to introduce Dr. Jaideep Malhotra, a global leader and internationally acclaimed reproductive medicine specialist. Dr. Malhotra is the past president of several prestigious national and international bodies, including Indian Society for Assisted Reproduction and FOXI. Dr. Malhotra is a global voice for women's health. She advocates for respectful maternity care and early breastfeeding initiation. She will share how global maternal health advocacy connects with breastfeeding and why a cross-sectional woman-centric approach is crucial. Over to you, Dr. Malhotra. We are eager to hear your perspective.
Thank you so much, Vandana, and a very, very good evening to everyone. And it's a pleasure for all of us that we are discussing this. It's a very, very important aspect, which I'm sure it's not only us doctors, but everyone has to understand, because breastfeeding is one game-changing activity which can actually change the future of our generations to come. So I really want everyone to really understand that why are we really celebrating this breastfeeding week? Because every day should be like a breastfeeding day, but it is an important area where we keep, reminding people that we need to invest in our health systems. Investing in our health systems, especially from a very, very early times, like pre-conception to conception to post-conception, can reduce the health burdens of all the countries. And that's why WHO, UNICEF issued this very important statement that we need to invest on health systems and support breastfeeding mothers, because I feel that somewhere we all understand that there are a lot of challenges which young mothers actually face as far as exclusive breastfeeding is concerned. Now, first we have to understand why breastfeeding. Now, normal things, people do understand that breastfeeding has many benefits, and it contributes to a lot of mother-child bonding. It contributes to a lot of improved survival, protection against a lot of infective diseases. It reduces the lifetime risk of obesity, asthma, and heart disease. And it's an optimal nutrition to the baby. Plus, it also prevents the mother from a lot of other problems and issues like malignancies, diabetes, heart disease, and so on. Now, there's another very important aspect which I would like all of you to understand is that we inherit more than our genes from our mother, because we inherit our microbiome from our mother. So if we are delivered vaginally, we inherit very good lactobacilli, or the healthy bacteria, which colonize in our bodies. And this is again then substantiated by the breastfeeding and then by weaning at a later stage. So these good bacteria in our bodies actually colonize, and then they dictate the disease and disability in our systems for the whole life to come, including aging and the kind of other diseases which we suffer later on in life. So if our gut microbiome is good, and which is inherited from the mother through all these, we are definitely going to be much healthier. Today you have to understand that we are the obesity, diabetes, hypertension capital of the world. We are also the preterm capital of the world. So we need to take some extra steps. Now, when I say this, only about 48% of the infants under 6 months are actually exclusively fed all over the world. In India, this percentage is even less. So why are we really talking about it is the next question which I would like to ask, because we have to understand that all our reproductive health, the care during our fertility, infant feeding practices are all very much interconnected. And this connection leads to very significant health outcomes for both the mother and the children. Now, there's a huge difference between when we say intended pregnancies, because some mothers are not very happy feeding their babies and the others are too happy. There are many challenges which they face. Like intended pregnancies, somebody is wanting to be pregnant, who has a lot of good family support, has good care, will maybe be much more adept and more ready to breastfeed than a person who has had an unintended pregnancy, or is not happy with certain circumstances, or has had increased risk with, like when we give fertility treatments, there are multiple pregnancies, so they have physical challenges in breastfeeding, multiple births or twins or this babies. So there are a lot of challenges which we as doctors have to understand. But we also have to understand that there are many benefits of breastfeeding apart from the mother and the child bonding. There are a lot of positive effects. There's much less postpartum depression and the other risks which I have already told, along with a lot of long-term effects, which definitely what we have seen is that if we have a holistic approach towards pregnancy and breastfeeding and postnatal care, then definitely this will encourage a lot of systems to be in place and a lot of reduction in the stress and the outcome of these babies. Now, let us understand that no matter how much we may have done, but we are still not as baby friendly or as breastfeeding friendly nation as we would like to be, because there are so many challenges. There are women who are like primigravidas, they are very shy, they are not aware of how the assistance for breastfeeding may not be as adequate, or their preparation during the pregnancy to encourage them through breastfeeding may not be available. And a lot of I would say the training of the doctors and the nurses is also not adequate in many of the countries, and this also includes a large part of our countries. That's why so many initiatives are being taken, and I want to congratulate Ujala for taking this initiative, because we as a hospital chain, if we put certain practices in place, I am sure that this will make a dramatic change in the times to come in our future generations, and that's something which is very, very important for us to understand. Now, there are ways of convincing people on how to breastfeed, and what is the correct way and what are the focus areas, because there are multiple ways of thinking. There's a government policy in place, there's a hospital system in place, there's a system of healthcare support system which should be in place. The nurses, the midwives, the doctors, all including the pediatricians, the neonatologists, have to think about breastfeeding and counsel and strengthen the whole support system and create a very nice environment which promotes breastfeeding on a larger scale, which is very, very important. And what I have seen is, as a president of FOXY during my year, we conducted one training program for ANMs in Indore. There were 1,500 ANMs who had come, and we had a whole session on the practices and the ways and support of breastfeeding. And so many of them came back and told us that thank you so much that you have touched this topic, because we were never ever taught the way we have been taught today, and we'll be able to support our population in a better way. So that's where the training of the nurses, midwives and doctors is also very, very important for breast friendly health systems to be encouraged, and also addressing the barriers is also very important. Now, only training is not enough. Keeping track, monitoring the progress is again a very important aspect. When we train people and when we promote breastfeeding, we must also keep a little track on how many women are actually, sort of exclusively breastfeeding and for how long, which is very, very important for us, because as we understand, WHO also and UNICEF has come out with that we need to have at least 60% of our population exclusively on breastfeeding by 2030. And that's a huge task for all of us. And I think we need to contribute to this, because this is definitely going to improve the health of our future generations. So what is important here is to create a sustainable breastfeeding support system. Now, when should this support system start, or when should the education start about breastfeeding? It should start right from the antenatal period, because now once the patient is already there in the hospital for a delivery, and if she's not mentally engaged into it, it's not going to happen as easily, and the health workers will definitely have to work much more. Sometimes that time or the mental frame is not there. And antenatal period is a very long period of 9 months, where we can get a lot of time to not only educate the mother, but to educate the husband and also the family to support this initiative, which anyway is going to be good for not only the child but for the whole family, because these children are much better as far as their immunology is concerned and their nutrition is concerned, and their fighting capacity for all the other infections and diseases is concerned. So if we really explain to them well, I'm sure then the adherence will be much better. Second important thing is that when she is in the hospital, right from the beginning, like from the skin to skin, and then the next 2-3 days if she's there in the hospital, that little extra support, making her comfortable in breastfeeding will definitely pay a very nice dividend for the little effort which we will put in, because she will be very confident. She will be able to balance breastfeeding and also manage her life. And again, the formula feeds which are there, which sometimes a lot of women say that, okay, can I do one night feed? Because lady also who's breastfeeding gets tired through the day, because if it is demand feeding, it could be like every 2 hours and all, and it's a huge effort. And if she is not well supported by the family, she is unlikely to continue. And a lot of times the mother-in-laws or the husband also comes and says, doctor, can we give 1 or 2 feeds in the night, which are formula feeds, because we all get very tired. Now, those are the things which we need to tackle, but we need to listen to them. We need to, respect whatever problems they are having, and then offer them a solution, and then make a very shared decision which they will be able to follow, especially because when you say that this is for the goodness of your child, this is for the goodness of your future generations, they will definitely be able to address this and follow it much better than only saying that, okay, breastfeeding is good for you. Okay, so that is something which we need to really understand and address, and this can be done only when we strengthen our midwives, our nurses, our pediatricians, our neonatologists, and all the systems. So that's where the cross-sector collaboration is very important. Now, this cross-sector collaboration, when I say, it does not only mean the gynecologists, obstetricians, neonatologists, and the pediatricians. It could be anyone. The midwives, nurses, it could be the education systems which are there, the clean sanitation, the privacy in the hospitals, good nutrition to the women, access to good education to all these girls. Now, there are a lot of things which need to be done, plus patient-friendly partnerships are very important, because sometimes when women are traveling or they are at work, there are no conducive areas where they can actually feed their children. So providing now these small booths which are there now in many states, which have been provided by our collaborating partners to make breastfeeding much easier and more accessible, is another very great idea, which I think should be available each and every place. And even in the hospitals where the staff is there, we need to create these areas so that they are able to look after their children, because once the staff also is at mental rest, they will also function much better, and same is true for the mothers and their families. So we, as doctors or as promoters for breastfeeding, we need to really look at a lot of these evidence-based practices which are very important for us. And I am part of the accountability group of PMNCH, which is a partnership for maternal, newborn and child health. It's a huge organization of one of the parts of WHO, which is working on maternal, newborn and child health. And as we look forward, there are a lot of strategies which have been actually put forward by PMNCH, which look after the stakeholders and also promotion of how to improve women's health and newborn and children's health in the countries all across the world. Now, there are many other organizations also which are working. I am not going to name all of them, but yes, our government also has started a lot of initiatives. And as PMNCH Executive Director, Mr. Rajat Khosla says, that we need to really focus on skilled breastfeeding counseling. We need to have, policy advocacy, which is very important. Digital marketing regulations are very important for us to, understand the key steps in protecting breastfeeding and parental rights, and also address the challenges during emergency, because there can be a lot of situations which women can face, and a continued support and e-counseling is something which will actually help us to improve this early childhood nutrition, to ensure that the children survive more, they grow healthy, and then they are able to, be good, healthy human beings. Now, what is really required at our end at all levels? Now, at the local level, collaboration between obstetricians, neonatologists, pediatricians, nurses, midwives, and ANMs, and even some organizations or NGOs who are working is very important. So we must develop, apart from the awareness program, this collaboration where everyone talks the same language and promotes systems and issues which are very important for the health of our generations. As during my presidentship, I started a program called Saath Saath with the pediatricians, because I feel that obstetricians and pediatricians have to work hand in hand for this important, crucial goal. And this collaboration, whether it's about information sharing or providing, consistent advice, or all of us talking the same language is also very important, because if we don't talk the same language, then the patient gets confused, and then our goals as far as the breastfeeding numbers is concerned, are definitely going to dwindle down. So in our hospitals also, we should develop this collaboration between all the key stakeholders, so that we are able to talk the same language and are able to support all these women at a very, very crucial time. And it is not an expectation, it is our duty. Now, another very important aspect is, especially now young couples are coming, all of them are working, so it becomes extremely difficult for working women to be able to sort of continue breastfeeding, especially without the support of the husband and the family. Now, a husband can play a very positive role, whether it is regarding encouraging his wife to continue breastfeeding, looking after his wife when she is breastfeeding. It could be either looking after her nutrition, or looking after the household chores, or looking after the baby when she is doing the other work. A very positive support from the husband is a very important aspect, which I think we must all invest in during the antenatal period, in encouraging the husband to come. And also, even if somebody from the family is there to support this lady during this very crucial time, especially keeping baby as the center and the health of the baby as the center. So these are very crucial partnerships which help in increased maternal confidence. They influence the initiation and duration of breastfeeding, which is extremely important for the health outcomes of this baby. It increases the positive impact of the breastfeeding, and as I said, fathers are the key supporters. Now, as for us, how can we strategize? We can strategize with education and information, promoting active involvement of all who are required. Like if the mother feeds the baby, the father can just take the baby and then help with the burping, changing of the diapers, and give a lot of positive emotional support. A responsive support goes a long way. A very good open communication between all the partners, along with the healthcare professionals, can actually address a lot of challenges. And this should continue from the prenatal to the postnatal period, which is very, very important. I would say that, there are two very good models which have been, and our BPNI has been at the helm of affairs for one of these projects at Maharashtra, which actually what they have done is they've taken up in mass breastfeeding training at various levels, which included like 1,000 breastfeeding rooms at workplaces, multilingual breastfeeding apps, comprehensive immunization. So there are ways of like supporting the doctors or the staff also, which can be there, and there are so many tools which Nupur just told us, which can be utilized. And similarly in Uttar Pradesh, in Lalitpur, one pilot project was taken up where they were offered a mother support group, offered 24/7 breastfeeding counseling and frequent structured home visits in 600 villages. Now this increased the initiation of early breastfeeding from 11% to 71%, which is actually our goal. And this is something which can be a role model, and I think we can all contribute. So even in our country, all the states have been given some targets, and if you can see, we have here in this where what is the existing breastfeeding practices which are there, and what are the numbers which we are really looking at the end of 2025 is the focus which we should be contributing to, so that we can actually look forward to a much better situation. Lastly, I would say that in spite of all the efforts which we have taken, still at least half of the primary-parous women have inadequate knowledge about exclusive breastfeeding, up to about 6 months, and maybe go up to 2 years, which is something which our intention is, and that is something which we should definitely be looking at. So I'd like to conclude here and say that creating a very sustainable breastfeeding support system should not be a short-term intervention. It has to be a mindset with all of us who are involved, in taking care of our women and our children, so that we can actually have a continuous, inclusive, empowering structure to safeguard the health and protect the environment and uphold the rights of our women and children. And this ultimately will become a pillar of sustainable development. And I think this should be a priority everywhere. And as Dr. Narendra has already told about this app, which I developed a few years back. Now, this is a very nice app, which all of you can actually recommend to all women who are actually, or couples who are trying to conceive. It has a preconception part, it has a pregnancy care part, and it also has a parenting part. And this is a very, very nice digital resource which can be actually utilized. And we have a pregnancy coach, yoga instructors, and also a nutritionist, which are available for any kind of advice which is there. So for all our population to help gain knowledge and confidence in looking after themselves and their children. Thank you so much for having me.
Thank you so much, Dr. Jaideep, for bringing in the much needed maternal voice and global vision, and for sharing the details of this app. This is really, really useful for the mothers and new parents. Now our final speaker is Dr. Usha Prabhakar. She is the Group Nursing Director at Ujala Cygnus. She will speak on empowering nurses to lead early initiation of breastfeeding and on building website counseling systems within the hospitals. Over to you, Dr. Usha. Thanks, Dr. Nupur, for sharing the resources in chat. We will circulate it with all the participants over the email.
Thank you so much, Dr. Vandana, for giving me an opportunity on behalf of entire Ujala Cygnus to represent a nursing fraternity and sharing this esteemed panelist along with the Dr. Narendra Malhotra and Dr. Jaideep Malhotra, Dr. Arun, and our founder, director of Ujala Cygnus, Dr. Shuchin Bajaj. So allow me to share the screen. Yeah, thank you. Not the least, I've seen that esteemed panelists, all of them have shared the significance of this breastfeeding and emphasizing on the golden hour, exclusive breastfeeding, and how we could able to help mothers in various ways. So more focusing on nursing perspective and what is the significance of this nursing fraternity contributing to the mother's maternity period, antenatal, intrapartum, postnatal, all the stages are very, very important. It is not that mother is coming and delivered and after that it is going to start. Hence the journey of this 9 months, as Dr. Jaideep rightly mentioned, it's a very long period to emphasize the significance of exclusive breastfeeding and advantages and how do you nurture the newborn. So some of the nurse-led initiatives and interventions to enhance the breastfeeding, I will be emphasizing on it. How do we extend the support and educate and counsel? This is what will be a major ones, which I will be talking about. And early initiation, as everybody said, and the nurses play a critical role in putting the baby breast crawl, as Dr. Malhotra mentioned. That yes, we practice breast crawl on the table itself, that as soon as the delivery happens, we will encourage the baby to crawl and reach out to the breast, and early initiation during the golden hour, the exclusive breastfeeding. Even in the labor room, we don't wait for the episiotomy stitch to happen and the completely placenta out. And as soon as the baby is out and baby is been cleaned, wrap the baby and put on the breast. So that is what some of the good practices we practice across, and the significance of advantages of this breastfeeding. If the mothers knows well in advance, I don't think so any mother will be opting for the top feed or the formula feeds. So very, very important that they are empowered. The worldwide baby friendly hospital data shows that if the nurses are empowered, the nurse-led lactation specialist nurses are being recruited in each hospital. These people, these special segment of specialized nurses play a very, very crucial role, and plays that exclusive breastfeeding data improves, and this maternal satisfaction rates are very, very high. Hence, the BPNI is providing this lactation specialist counseling courses. 7 days of courses there, and many more other courses are there. Internal or external trainings will empower our nurses to take or opt for the lactation specialist role and educate the mothers and counsel well in advance. So it starts from the antenatal period itself, while mothers are coming to show in antenatal. After that, we must encourage to go and meet a nutritionist. That is a part of the antenatal, but lactation counselor also, we should encourage them to go and meet so that well in advance we can emphasize it. The initiation of this first breastfeeding within the golden hour, 1 hour, if we start capturing the data within the labor room and OT, that will emphasize that the compliance percentage and how good the nurses are counseling it and adherence to this exclusive breastfeeding all will come up as a one notion, one drive to support the mothers. Each drop of breast milk is a drop of love, protection, nutrition and connection. So if they know the advantages, I'm sure we will be able to achieve that. And also this will be helping us. Early skin to skin contact helps to maintain, regulate the baby temperature, which everybody knows. So kangaroo care is something which we practice very well in Ujala Cygnus, and so we all must teach that skin to skin contact is very important, which will be a very helpful. And also it will transfer the skin friendly bacteria, so we should encourage. And empowering nurses, not only in terms of knowledge empowering, they need to implement what they have learned through the counseling, that is called effective counseling to the mothers. So understand the significance of breastfeeding and advantages, then optimal breastfeeding techniques, the positioning already ma'am has spoken about it, Dr. Jaideep, but the positionings, all the positions should be very well with the mothers so that they can opt for it and right position. Hence, we can prevent the low back pain. Usually, we have seen the mothers are opting for the top feed, 1 or 2 feeds in the night, because they have a severe low back pains and because of the poor positioning and not having enough support. Identify common breastfeeding challenges. The challenges, if they are aware about it and the nurses are taught about the challenges, they can prevent it, and if they have, they can identify it. Some of them can be a cracked nipples and engorged breast and tenderness. Many things are there, excessive feeding, so flat nipples. So if they are aware about it, the mothers, we can come up with the challenges, identifying, and then managing it will be a crucial role. And some of the support which we have to provide is highlighting the home care support is very important. Not only we will be providing antenatal and intrapartum, but postpartum is also very, very important, postnatal period and up to the home, and follow up has been mentioned by the previous panelists, that home care, we have a checklist. We will be calling them during the follow-up. We'll see that are they following the exclusive breastfeeding or not. So these are the roles very significantly played by the nurse-led lactation counselors. Emphasizing on exclusive breastfeeding, I will not go with the advantages of breastfeeding, but very important that it is helping, enhancing the digestive health of the baby if the mother's knows, and immune system point of it. And some of the baby obesities, we are seeing it very, very high nowadays, and BMI is very low. So what are these factors contributing? How it is, if the mothers have been educated, they will opt for it. Not only it will increase the bonding and emotional well-being, but also the nutritive values are very important. These positions needs to be displayed everywhere, and mothers are well versed with the opting for the comfortable position. Not every mother will be comfortable on one position. So if they have a choice of it and they know it, this we do it during the antenatal period itself. When they come we do a workshop, and all the antenatal mothers sitting in one room and opting and practicing with the mannequins, so that when it comes after delivery, they will not face any challenges. And some of the very, very important are not only lying down, but the positions are very important, and they can choose it. The extra pillows, which we always emphasize during the antenatal, that make it available. There will be a lot of pillows are there, which will be cushions, which we say V-shape, L-shape, extra cushions. If they are readily available, then immediately you can support it. Some of the myths and facts where the nurses play a very major role in relieving that kind of myths. Breast milk, usually mother says that ये बहुत गाढ़ा है, ये बहुत पतला है, पानी जैसा है. baby ka pet nahi bhar raha hai. Very common phrases we see nurses, and usually the mother's go-to person is a nurse, because 24/7 the nurses are the one who are available, and they are the one who does the daily rounds. And during the rounds, we identify, we assess the breast, and we see the problems, and some of the challenges then and there we address, hence enhancing this exclusive breastfeeding. So colostrum, and if they know that this is the first 3 days or 1 or 2 days there will be a colostrum, and then there will be a milk color will get changed, the quantity, the amount which is required for the baby. Again, mothers think that baby ka pet nahi bhar raha hai, ek feed extra mein de दूं क्या, baby rote जा रहे हैं, या mother need rest. As Dr. Jaideep rightly mentioned, night में 2 feeds दे सकते हैं, या midnight feed mother को सोने देंगे. This is how the grandmothers or the caretakers or the fathers think about to look after the maternal mothers. But what our role is to tell them that baby doesn't require, baby's stomach is very small. So if they know it, that then their anxiety levels get relieved, and they think that yes, whatever is done on demand feed, what we are providing it as exclusive without end of feed, is sufficient for the newborn baby. That is what a very clear message have to go, which we usually see in the mother's cracked nipples or the baby positioning. And along with that, a major challenge is latch. They don't know how to have a better position, hence land up with the cracked nipples and sore nipples, or their pain while giving the feed, and they think that let me rest and give one top feed because of the lack of knowledge and the lack of technique while providing the breastfeeding. So latch is a very important technique which every nurse should encourage to know herself and to teach to the patient. And lips are flanged out, and properly the positioning of the breast have to be proper, and the areola have to be completely, the dark part of it have to be completely in mouth, so that the sucking or the traction or the suction which we talk about it is not into the edge of it. It's a completely covering the areola and encouraging the enough milk to come up. Not only latching, but we also see that delatching is a very important and contributing factor for some of the challenges. If the baby fall into a sleep, which is very natural, we have seen it. Most of the mothers say that "Bacha so gaya, to ab kya fayda?" So they will pull out the breast automatically without disturbing. They think that it's disturbing the child if they will do delatch, but that's not true. And unintentionally they damage or they crack their own breast nipples. So that is also again one of the factors that top feeds are being added up along with the exclusive feed, irrespective of a lot of counseling, a lot of teaching, a lot of education. Mothers are well aware about it, but technique is poor, irrespective of knowing. So we must teach them the delatching by little finger, corner of the mouth, you gently place it, and then relieve the suction or the traction or the pressure in the mouth, and then gently remove the breast. Hence, you will not damage your own breast. So this is how again biting the breast can be avoided by adequate technique. They are burping some of the challenges which we see, and primary mothers or the first time delivered mothers, nurses are the they play a crucial role in teaching and training, otherwise regurgitation, and then they will throw up the milk. So burping techniques, again part of the lactation nurse counselor's role. There are 2 techniques: take up the high shoulder and then gently tap it, or you make the baby onto your sitting position in lap and then gently forward moving, and then wrap, gently pat on or rub on the back of the baby so that burping happens, and then put them into sleep. It's very important that antenatal period the nurses play a crucial role, not only in educating but assessing the breast and saying it that is it a flat nipple, retractor nipple, or then accordingly we will prepare the mothers, we'll escalate to the doctor, and then enough care is being given, massaging has been done, and then try to prepare the mother so that the later journey will be easier and breast friendly. support can be provided. Encourage not only the mother but the father. So during the workshop, father friendly, as Dr. Malhotra rightly mentioned, we always teach and train not only the maternal mother but also to the father and the grandmothers to encourage and support the journey of during the intrapartum. Obviously breastfeed and putting them into a breast as soon as possible within the golden hour, capturing the data that what is the compliance percentage in nurses playing role in maintaining the exclusive breastfeeding. At the time of discharge, we monitor that how many mothers or babies are discharged only on exclusive or the top feed, how many newborns land up into a jaundice or dehydration led to a hyperbilirubinemia, or the how many top feeds have been given, what are the some of the challenges mother faced, what are the complications while feeding they have. These all things will be capturing, hence making into a very, very effective lactation and breastfeeding friendly hospital. When we say we have to practice with the evidence practices, evidence-based, and some of the tools we use it, some of the checklists or audit mechanism have to be very significant when it comes to the nursing role. And see, some of them are postnatal or during discharge. We emphasize from the nursing perspective that during the discharges, nurses also give the written discharge instructions to maintain exclusive breastfeeding, and some of the contact numbers if they face any kind of a challenges, so that lactation consultant will be available and providing it. If they have any problems, will be identified. As rightly mentioned, cesarean is one of the myth that cesarean mothers may not be able to feed in a early 12 to 24 hours, and hence the top feed is important. Or a separation, the baby needs to be in an ICU, or a baby needs to be separately kept and well looked after by the nurses, and the mothers are resting, is no more. That myth is gone. The sooner the baby, the mother is on the table itself, we are putting the baby onto the breast and maintaining the exclusive breastfeeding. Early mobilizations, we are encouraging mother to get out of the bed and take a walk, sit out of the bed and feed the baby in a position. Comfortable pillows and other accessories have been provided. Taken care of the pain management, monitoring and support, counseling the mother, extending the support, putting the baby onto the breast into a right technique, right skill. These are some of the things which nurse-led in Ujala Cygnus we do it. And some of the top challenges, as already mentioned, I will not take time as being the last speaker. I think time is already running short of it. Sore nipples and low milk product, engorgement, plugged milk ducts, mastitis, insufficient milk. These are some of the very common layman language. The mothers come and inform at a nurse's desk that I'm having these problems. Apart from other things, these are some of the typical pics which we can see it because of the poor technique, lack of knowledge, lack of support. If we will able to provide and escalate, identify during nursing rounds, effective rounds, if we'll make it, assessment is very key from the nursing point of it. Identify, sooner the identification, you will start managing it. If there is a crack at nipple, then you apply a cream. Encourage to feed from the other part or other side of the breast, alternatively feed, on-demand feed, positioning, engorge breast, then apply warm compress before even reaching out to the doctor. You can resolve it, and manual expression is very important. If there is a tenderness, mastitis, identify it before reaching to the completely infected and IND requirement. You are the best person. Nurse-led techniques, every nurse is empowered to take decisions and cold compress, and then rest, counsel, inform, if required, provide antibiotics. Again, it's a nurse-led. Encourage mother to feed on the same breast, need not to be avoid, and gently massage, and then take the massaging step, breast towards nipple during the feeding itself, and you can resolve the milk duct even into getting into a blockage and then getting into a further complicated stage. So the what I'm going to say is nurses are to be empowered. They need to be provided additional lactation counseling, certification-based trainings, identify them, and every department should have a one nurse, especially in the ward and labor room and OT and antenatal period itself. You start it. If it requires, you express the breast milk. In some of the cases where the baby is an extremely preterm baby and baby is in an ICU, or low birth weight babies, or engorged breast, or inverted nipples, or newborn baby maybe jaundice, or mothers who had joined to the work very early stage, before even completing their 3 months, over lactating. Sometimes we see that milk is overproduced, a problem with the latching, or they are having cracked. So these are some of the cases where we encourage mothers, we teach them how to express by using the breast milk, and storage is very important. If they know it, they can store it and they can provide it. If it is a room temperature and not having refrigerator 4 hours, you can keep it and you can feed it. Whenever you are getting milk, extra milk, you can store it, and then when baby wake up, you can provide it. Refrigerating into 0 to 4 degrees, 4 to 5 days, you can use it. If it is under minus 18 degree, then 6 to 12 months. And we have a milk banks everywhere, and we have a donor milks, and we provide and we maintain exclusive breastfeeding for first 6 months for the baby growth. Do not, once it has been thawed, you cannot defreeze again. Once it is out from the defreezer and you have brought it to a room temperature, and some reason if you are unable to give it, you cannot thaw again. So some of the things nurses are very well, and balanced diet already Dr. Lipat very well mentioned. Working mothers, the support is very important right from the antenatal period. So we start encouraging teaching and training so that exclusive breastfeeding data can become up. As Dr. Arun mentioned, that it is 50% or under 50% of the people are still not on exclusive breastfeeding, even though they are hospitalized, and deliveries are hospitalized deliveries are happening. Cesarean rates are gone up. But irrespective of that exclusive breastfeeding, I don't think so any reason we will not be able to do it other than a right indications. If there is any clinical indication, that is the only way. Otherwise, we should be maintaining the exclusive breastfeeding very, very high data. And after the delivery discharge, we still maintain. Some of the postnatal mothers getting into a depression, if we can identify by giving a call, are they maintaining, is there any early symptoms of depression, that is also can be captured along with this support mechanism and early recognition of some of the challenges. There are some of the checklists which we maintain in hospitals to maintain evidence-based techniques have been followed. Mothers are supposed to be given some tips that right kind of a nursing supplies in terms of a breast support ways, so that engorged breast can be prevented, right kind of a brassiere can be worn, cleanliness, cleaning of the nipple, cleaning of the hygiene of the breast, alternatively feed, use both the breast, and then positioning, and then a good diet and good sleep and yoga and meditations, all these things. And if they have any kind of a problems, reaching out, and then that's how the nurses will reach out to escalate if requires to the doctors and provide support. Continuous counseling is very important from the nursing aid, and tools we are using it, a lot of audits and checklists, and nurse-led lactation counselors are really helpful in maintaining it. Thank you so much, Dr. Vandana and entire Ujala team, for giving me this opportunity to share this platform with the esteemed panelists. Thank you ever so much.
Thank you, Dr. Prabhakar. That was a powerful reminder of the critical frontline role that nurses play. And I can see most of the questions that were there in the chat box are already answered by our speakers through such detailed presentation. Still, before calling it a day, I would take a couple of questions. And the first one is for Dr. Arun Gupta. Sir, in your experience with policy, advocacy, and global monitoring, what policy reforms are most urgently needed in India to reduce industry interference and protect breastfeeding practices within health systems?
I think we have a very good policy in India to check that. So I haven't seen such a good law, and not very well implemented. I would say partially implemented, but health system is at a fault to implement that law. So one part is that the government's machinery, which is a criminal offense to violate that law, means that you have to go to the police to complain, or you have to go to the criminal court to lodge a complaint. BPNI is notified under the Gazette of India to do that, but we really don't do, because it takes ages, I remember filing a case on Nestle in 1994, and it took 17 years to frame charges, and the High Court let them off. So it's something with the policy is very strong, but its implementation doesn't get. So I will only request that every health system, as every speaker has today mentioned, that we can take lead. Ujala Cygnus has this opportunity to lead this awareness. Even if you require BPNI support to address only IMS Act in one of the webinars, I think all the hospital staff should attend it. Jitne bhi aapke अस्पताल hain, they should understand, they should learn, they should be aware that if a company comes and gives you incentives, don't take it. If they don't know, they will take it. So that is one of the biggest problem as of now we are facing, is that companies come to the doctors and they tell them, okay, we'll take you to Missouri and we have a conference there on, say, for example, conference on, some other chapter like nephrology, right? So, but they will take pediatricians and neonatologists there and, serve them for good 2 days in a 5-star hotel. And they come back, definitely they come back, indebted. So to my mind, this is something at a policy level. I think Ujala Cygnus can try this out to share this presentation and send a letter from the executive to all the hospitals and staff that at the most, if they really want to allow representatives of food companies, they cannot give more than information to them. So they can only give information, no samples, no incentives, no sponsorship of any workshop, no meals, not even. So now I'm listening that nurses are being targeted by them. So that's another news, that pizzas and other parties are being served in hospitals. So for implementing this, I think every hospital has to take a lead in. We can only assist in passing on this information. So we are not very keen to go to the courts, actually. Yeah.
Thank you so much, sir, for your insights, and definitely it can be implemented to control such things. The next question is for Dr. Malhotra. So someone is asking, how can clinical teams avoid unnecessarily formula use in newborn care, especially in the face of...
So all NGOs, society, social media, I mean, everywhere we should bombard it with breast milk, the best milk. And that is what is required. And of course, as just Dr. Arun said, strictly say no to all these formula feeds. And of course, at birth, immediately the golden hour should be followed so that they get attached to the baby and they get counseled for breastfeeding. Mera cesarean hua hai, mere ko darad ho raha hai, I can't turn around. I mean, you can breastfeed them in any position, and that is what we have to tell them. There are such lovely training modules for it. We at Foxy are trying all this. It's difficult, but I think we should not give up and keep on trying.
Thank you, sir, for doing such an excellent work and supporting this initiative. And the role is really important in doing that. The next question and the last question is for Dr. Nupur. So given your expertise and experience, Dr. Nupur, what are the biggest challenges in translating national breastfeeding policies into effective practices at the district level hospitals?
Thank you for the question. In our experience, with, say, having a breastfeeding policy or a guideline in the country, many a times it is launched at the national level, but it is not circulated or disseminated at the district level or at the village level. So many a times they are not aware of it. Another thing is that when something is not monitored, so it is not implemented. So that's one aspect. So we especially stress upon monitoring breastfeeding practices and breastfeeding data in hospitals. Even in Anganwadis, it has become more of a tokenism that is recorded in an iPad and send it. We all know that sometimes we are not even sure that if it is authentic data. So one is that, and another is at the district hospital level. Sometimes sometimes, when they get their staff trained, sometimes the staff changes, so the trained workforce changes. That's also a challenge. So maybe therefore it is important to institutionalize a periodic training program, a skill training program where no matter what staff exist or changes, it's a protocol of the hospital to have that training periodically so that everybody is trained. And if a breastfeeding policy is in place, then it is shared with everyone as the standard to be followed. Then they don't have to look for. Therefore, we say institutionalizing the data management and having a breastfeeding committee is very important. So these are the challenges, and for private hospitals, we believe that we are also working for through advocacy that all the private hospitals should get an advisory on MA program guidelines. They should also, because it is only for government hospitals. Even the government hospitals, the implementation is weak, but private hospitals, it's not an obligation at all. So we are working on that the private hospitals do get an advisory from Ministry of Health on implementing MA program. Thank you.
Thank you, Dr. Nupur. I absolutely agree, because the major part of the country is served by private hospitals, and especially in the small towns, the majority is going to the private hospitals. So definitely this is required. Thank you so much. As we draw this insightful session to a close, let me take you through a brief story of what we have experienced today. Imagine a mother holding her newborn for the first time, nervous, hopeful, and full of questions. Around her is a system that can either empower her to breastfeed confidently or silently let her struggle. Today, each of our speakers became voices in that room, voices of policy, practice, and empathy. A big thank you to all of our speakers today for not only sharing such rich insights, experiences, and evidence-based recommendation, but also for painting a future where every mother is seen, heard, and supported. Let's carry this story forward into our hospitals, into our communities, and into the systems we shape. Because in doing so, we are not just promoting breastfeeding, we are nurturing a healthier, more compassionate world. At Ujala Cygnus, we remain committed to integrating breastfeeding support into our systems, training, and advocacy efforts across all of the hospitals. Thank you for joining us today, and let's continue this momentum beyond World Breastfeeding Week through daily actions and systems that protect, promote, and support breastfeeding. Let us work together to ensure every child receives the gift of mother's milk and every mother receives the support she deserves. Have a wonderful day ahead. Thank you so much, everyone. Have a nice weekend. Thanks a lot for joining us and sharing your wonderful insights.
Bye. Thank you.